He graduated from Creighton University Dental School. He's been practicing in Florida for over 20 years. He's one of only 500 board-certified implant dentists in the world. He'll be speaking on the 7 reasons why you should do dental implants. Before I bring him on stage, I'd like to tell you about our exciting raffle today. One lucky winner will receive a gift certificate for a free dental implant valued at $1,600. As a special unannounced surprise, we are also giving away 4 $20 gift certificates to the Broken Egg Restaurant. We'll be drawing winners at the end of the seminar. So without further ado, I'd like to introduce Dr. Joseph Gaeta, Jr.
I want to thank you for stopping in. I know there's a lot of activity out there, and so I'm going to do my best to give you as much information as I can. There's a few of you, so if anyone has a question, don't hesitate to raise your hand. I have some slides. I'm going to go over a little bit of the history of dental implants and a little bit about myself. In the old days, the success rate was minimal. I actually have some old vitreous carbon implants back there that one of my mentors had placed, and they all failed. Now they're made out of titanium, and I'll go through that. So, a little bit about me. I had a lot of postgraduate education. I have over 1,000 hours in postgraduate implant education. I'm a board certified implant dentist, and in order to become board certified, you have to do so many cases, about 50 cases, and then you have to present them to the American Board of Oral Implantology that's in Chicago, and then you have to take an oral and a written test. So there's a little bit of work behind becoming a board certified implant dentist. And this is why I do this. Okay, there's my 2 kids, 2 of my 4. Sammy, Joe, and Joey in the bottom there. I just got back from a football game that my son Joey played just now. And on the top left is the restaurant that I pretty much grew up in. That's Gaeta's Restaurant in Omaha, Nebraska. I'm originally from Omaha, born and raised. And my mother's had some implants for, gosh, I don't even know how long. How long has it been? 10 years? So she'll get up and tell you a little bit about that. Okay, a little bit about the history of dental implants. This is a lower mandible that dates 600 AD, and what they did is they tried to put a little something in there to represent an implant. Implants aren't new. Prototypes of implant designs date back to the 1940s. Okay, so long-term implant studies during the past 45 years have given implants a very high rate of success and predictability. Okay? So you say, well, what is an implant? What is a modern dental implant? A dental implant is a man-made, here's the definition. It's a man-made replacement for the tooth, for the root of a missing tooth. So all your dental implants nowadays are made of titanium, just like your hip or your knee. There's a term called osseointegration, okay? Which is when the bone grows and locks the teeth into the bone. It's a biologic attachment of the metallic implant in the vital bone. Bone loves titanium, just like a hip or knee. So what happens is that the implant is placed, and there's threads on the implant, just like a screw. And what happens is the bone grows over time and locks the implants into place. Here's some examples. So if you go to these are examples of osseointegrated implants. In the old days, they made them without threads. These here. That's the kind my mom has. She's had those for 10 years. Now we put threads on them, and they're screw retained. If your dentist, if he places implants, and he uses one design over another, what we found out over the years is that they all work. Okay, but some of them have a little bit more research and development, R&D behind them than others. But basically, all implants pretty much work. Some advantages, you don't have to worry about food restrictions. They're stable and comfortable, they're easy to maintain, and they can be treated like natural teeth. They don't decay. So an implant won't decay. So you don't have to worry about any decay. You don't ever need a root canal with an implant, which is a nice thing. And it's a long-term solution. It's a long-term solution for a problem. Okay. This is one of the most important studies. This is why I lecture about implant dentistry. In this study, this is the National Institute of Health. And if you want to read along with me, it concluded that patients who maintain most or all of their teeth, or have missing teeth replaced by fixed bridgework, or have teeth supported by implants, live 9.8 years longer than those patients who have lost their teeth or who wear removable dentures or partials. So if you think about it, if you have dentures, it can take years off your life. And with implant dentistry, you can snap the teeth in and be able to chew again. So I'm gonna stop here, and I'm gonna introduce a really good friend of mine. He's also a patient of mine that had a denture. His name is Herman. Okay, this is Herman here. He's had a denture, and now he has fixed teeth, so he actually threw his denture away. He threw it away. So Herman, wanna tell everybody about your experience? He came from Port Charlotte, and he drove all the way up here from Inglewood. Okay.
First, I have to tell you, I got here a little early, and there was a Baptist preacher in here. So now you know I have to tell the truth. Just the way it is, Anyhow, I'll tell you my experiences. In the early 70s, I had all my teeth pulled. And I didn't like dentures from the very day I had them pulled and they were put into my mouth. Immediately, I couldn't taste food. They kept falling out of my mouth. My shirt, if I didn't have a shirt with a pocket in it, I was in deep trouble because that's where my teeth were. I picked them. I'd go to the restaurant and I'd put the menu up there and quick stick the teeth in there and eat quick like I quick stick them back, Anyhow, I'm 88 years old, and about 12 years ago I heard about Joe, and I've always been interested in implants because I wanted to get rid of the thing I had in my mouth for sure. And I met Joe, and he told me what the procedure was, introduced me to his staff, and off we went, Well, the first thing that he did was throw my teeth away, just that you don't need them anymore. He made me a temporary set of teeth without the palate and everything so you could taste food. It was really great. I was happy. All this period, it took about a year really to do the whole procedure. I had a full mouth, First you had to put some bone in there. And I always tell a joke. It was cow bone, and for the first week or two I run around saying moo. People thought I lost my mind. And of course I'm getting old, so they thought I could believe that. Two things. Old age really has some good advantages. We can forget very easily. Anyhow, he put this debt, and we waited 4 or 5 months, and then he put the implants in. And the thing he torqued them. I thought, we're not putting studs on a cow, we're putting teeth in here. He torqued them. I thought that was the neatest thing. Anyhow, he did that, took another 2 or 3 months, then he put the teeth in. And I've had them ever since, and I'm happy with them. But along the road, I don't know that Joe knows his business. He was a dedicated dentist. He had a good staff. They were all compassionate and concerned people. And it's important. It's nice to be able to go to the dentist and be comfortable. There are not many dentists I know that I would go to be comfortable with. But I guarantee you, the best decision I ever made was to come to Joe and have me do my teeth, So it's, all we really got in this life is our health. Without our health, we might as well all die. I don't care how much money we got or how much whatever we got. All we have is our health. And one way to get health is to be able to eat right.
And I want to bring up, this is my mother. This is Josephine. She's down here, and she's out of the cold weather from Omaha, Nebraska. So, Mom, you want to tell them a little bit about your experience with dental implants?
name is Joe Gaeta. My son is Dr. Joe from Omaha, Nebraska. That's where Joe went to Creighton University. I came out here for the winter. Okay. For the last 10 years, my husband and I, Joe Sr., we would drive over here to see our favorite dentist. This last year, my husband passed away, so I came out this year just to spend the winter here. We were married 58 years, and we sure missed him. I had my denture made, it's been a long time ago, and Joe put 3 implants in the bottom bar, and it really helps to keep the teeth in. Let's see. I'm sorry I didn't have them all put in about 10 years ago. If I went to get them now, it's sort of late. But you're really worth it. If you really want you to be able to eat and feel better, I really suggest getting the implants. Because from everybody I know, they say you can't beat them. So I think they're worth it. Thank you.
Okay, perfect. Okay, so that's food for thought, okay? Okay, so implants maintained, this is real important. We talked about the silent aging process. That was the topic of the seminar, okay? So what happens over time is that you lose bone. And Heather, can you grab me the atrophic mandible? You lose bone. So once they take your teeth out, you lose bone. And it gradually, it shrinks, okay? And this is an example. This is an example of what happens. This is a lower mandible. Once you take your teeth out, the bone gets lower and lower. And I'm going to have Heather pass this around. But if you place the implants in here, it stops the bone loss. So it stops that appearance of that wrinkly face appearance. Plus it increases your bite force. Okay, so without teeth, the bone in your jaw, your bone begins to shrink, like I showed you. This is called bone resorption. Okay, so once they come out, they constantly resorb. Okay, you can wear dentures to maintain your facial form, but denture wear doesn't arrest the bone shrinkage, so it doesn't stop. Okay, the amount of bone loss the first year is almost 10 times greater than the following years. So you lose about 4 millimeters of bone per year after the first year. This is an example where you get your face appearance, your chin gets closer to your nose. So tooth loss consequences. What happens when they're lost? When you lose teeth, you lose bone. Bone needs stimulation to maintain form, density, and strength. So just like if you put a cast on your arm, if you put the cast on and take the cast off, your arm seems smaller. What happens because of lack of stimulation, the bone strings and the muscles become flaccid. So and another thing that happens is you get thinning of the lips, your lower jaw protrudes farther out than your upper jaw. Within the first year after the teeth are lost, the jawbone loses 35 to 40% of its height. Okay. After wearing dentures for 20 years, the jawbone becomes a pencil thin and flat. The bony ridge is no longer present to hold the denture in place. Do you have a question?
Yeah, what kind of maintenance is there?
The
Like that's
question
snapped
was,
on and off. Do you have to take them off to clean them? Or
well,
anything?
yeah. If the question is what type of maintenance is there for the implants? So once you place an implant, let's say you have full dentures, you place the implants in, the bacteria in your mouth can form and accumulate around them again. So it's just like a natural tooth. So you can get plaque around them, and then you have to keep them clean. And but with the dentures, you take them out, and you brush them. You treat them as if they were natural teeth. Okay, you take them out, you have your teeth clean. Normally, what we ask you to do is come in 4 times a year, every 3 months. We want to make sure it's an investment. We want to maintain them. Okay.
Well, what if you only want one? Say somebody knocks your tooth out. You only want one.
You could do one. Absolutely. You can place one. There's got to be enough bone there. If you get the tooth knocked out, the question was, what if you only want one? Well, if you have a denture, one won't hold it in too well. But you got to have at least a couple, But if you have one tooth that's out, you can place one. Yeah, you can do one. Other questions?
When you have, not dentures, but a plate, they only last so long. You know, do these crack eventually or break?
Well, so the question was, you know, if you have a plate, you know, they only last so long. So, you know, how long, you know, naturally. So the answer to that is everything wears, you know, everything wears out, unfortunately. And then, you know, you have to replace the denture. And there's little clips in the denture that they're made of like a nylon. They snap on. You know, you have to replace those. You know, so there's, you know, there's normal maintenance. There's an investment plus there's maintenance. It's like when you buy a car, you have to change the oil, you know, have it serviced.
But how long do the teeth last? Like,
Well, they can last 5, 7, 10 years. You know, it just depends on, you know, your bite force and what you chew. And, you know, there's something called parafunction if you grind your teeth or if you have a really high stress job or something. You know, it just depends on your lifestyle.
Dr. Gaeta, can you explain, this gentleman would like to know, how does the tooth stay on the implant?
You can, so the question was, how does the tooth stay on the implant? You can glue it on or you can screw it on, just like a normal crown or a cap, okay? You had a crown before, because the implant, what the implant is just an artificial root, it's a screw. And then it has threads inside it, so. Well, you gotta think about, because dentistry is all engineering, it's all engineering. A screw is better, you know, a screw is the best, you can screw the teeth in. Because you can have a denture that you can screw in, okay? Or you can have a denture that you can snap in and out. With single teeth, you glue it in just like a crown, okay? It's just like a crown. You put the implant in, you put this post on there, and it's just like, then you take an impression for a crown, and you put the crown. Same thing, okay? So with magnets don't hold as strong as a screw would. The screw is the best. We're at the booth like right out here, so I'm here all day. I'll be here tomorrow. You can call me, talk to the girls. My staff's been with me for a long time. You know, Heather's how long, Heather?
10 years.
10 years, Patty?
18.
18. So they know dentistry all, you know, better than me some days. You know what I mean? So then, okay, well, insurance plans paid for it. It's hard to say. We're gonna have to wrap up.
Okay, Patty, go ahead. Richard? All right, good. We also have, go ahead and draw 4 more. We have 4 $20 gift certificates to the Broken Egg.
Hello?
Oh, good. Congratulations.
David North?
Hey,
Yay.
let's eat some free food.
You do car detailing, don't you?
Yeah.
There you go.
Okay, Bert?
Hey, Bert.
Will they do an implant down there at the Broken Egg?
Okay, now if everyone would like to go to booth number 700, we will be making appointments there for free implant consultations. Just come on over and we'll take care of you, okay?
Thank you.
Thank you for coming.
Thanks, folks.
Have a great day.
Enjoy your day. Thank you.